Medwatch 7 is sponsored by Comanche County Memorial Hospital.
Hospice is for people who have a terminal illness and are no longer seeking interventional treatments or are no longer a candidate for them. I spoke with the new medical director for CCMH Hospice about what age someone needs to be to get hospice treatment, how often patients are visited, and if someone gets on the service, does that mean they have to stay on it? Dr. Paul Neosi, the medical director for CCMH Hospice, says hospice is very patient-driven and focuses on what they want, which is why he encourages people to talk to their doctors and their families about what they want as their health declines. So if there comes a time a patient can't advocate for themselves, their wishes can still be carried out.
Sometimes the patient is the one who comes to the doc and says, you know, maybe they have a chronic illness for years and it's just slowly taking a toll. And they're just tired and they don't want to go to as many doctor visits, and they may request a referral to hospice at that time.
He says they have one main question they try to answer when establishing if a person of any age is a candidate for hospice.
If we left natural processes to themselves, could we expect death within 6 months?
If the answer is yes, he says they then look at other criteria and what the diagnosis is.
That doesn't mean that patient's going to die within 6 months. It just means that could we reasonably expect that to happen if we left natural processes?
Dr. Neosi says they look at the criteria every 6 months, and if a patient isn't declining and doing well, they can be discharged from hospice.
And they can revoke hospice at any time. Just because you sign up for hospice doesn't mean that you're locked in forever. You know, if you change your mind, you can change your mind and you'll be discharged off hospice and can seek interventional treatments.
He says the care is typically covered by most private insurance companies as well as Medicare and Medicaid. Treatments for patients are done through a team of doctors, nurses, aides, a chaplain, and a social worker. As for how often they come by, he says that depends on a couple of things.
Typically, at least once a week, you're going to have a nurse visit, but then you're also going to have visits from maybe a social worker and then a chaplain. And sometimes we'll try to stagger those visits so we can have somebody in the home on a more frequent basis. Some patients want to try to minimize the visits, and we'll try to respect that as much as possible.
He says as a person's condition declines, nurses will increase the number of visits they make to the patient.
There are a lot of people that use it, but I think it is underused. A lot of people miss out on that support and that service that hospice does provide.
Dr. Neosi says they'll go where a patient is. So if they live in a nursing home, they'll go there. And if they live in a home, then they'll go there. In other health news, Comanche County Memorial Hospital is holding a ribbon-cutting ceremony and grand opening for their new Memorial Express lab. It's happening on Friday, February 14th from noon until 2. The lab is located at 2720 West Gore Boulevard in Lawton. For Medwatch 7, I'm Haley Wilson.